Welcome back to Murder of Facts.
Professor Christopher Blyth has nearly 2 decades' experience in clinical paediatric and infectious diseases research. He's a clinical academic, NHMRC Emerging Leadership Fellow and Director of West Farmers Centre for Vaccines and Infectious Diseases, we know as Telethon Kids Institute. He's a Professor of Paediatrics with the School of Medicine, University of Western Australia, a paediatric infectious diseases physician at Perth Children's Hospital as well. Professor Blyth was appointed as a member of the Australian Technical Advisory Group, we know as ATAGI, in 2012 and served until 2021, and has been instrumental in a number of significant changes in national immunisation policy. It's a great privilege to have him with us today. Chris, thanks for joining us.
Very happy to be here.
We have a really interesting podcast this morning. Australia's seeing measles at a rate that we haven't seen in 10 years. That's an unusual public health situation to be in, and Australians really need to understand what measles is all about, particularly parents who may be busy, finding it hard to get to immunisation and keep up to date. Chris, first let's start with what is measles and what are the symptoms?
So measles is an infection, a viral infection that has been around for centuries. Importantly, it's an infection that affects those who've not been infected before. So either vaccination or past infection is highly protective against measles. And what it causes, it causes a respiratory illness and fever and rash. So the classic measles-like picture is people start with a high fever, cough, conjunctivitis, so redness of the eyes, and then that progresses to a rash. And the complications of measles are often respiratory, so a pneumonia-like a picture, and a small proportion get brain infection and swelling as well. And as a result of both of those processes, unfortunately, measles is a virus that has in the past, and there are evidence of cases at the moment, measles kills.
And measles has a fairly distinctive rash. Tell us about the rash.
It does have a distinctive rash, and importantly, we are very much highlighting to health professionals in the community what the rash looks like. So it is a rash that is red, it's spotty, it doesn't have blisters like a chicken pox-like rash. It often starts on the face and goes through to the trunk, and there's not a lot of normal skin between the episodes of the rash. But rashes are sometimes hard to pick, so I certainly wouldn't be highlighting to parents they need to look out for a specific type of rash before thinking about measles. They need to jump in before that.
And is that rash itchy, the measles rash?
Not traditionally itchy. Chickenpox is a really classic itchy rash. The rash of measles is not classically itchy, but the child is often uncomfortable by nature of the rash and all the other things that are going on. But when we talk about child, I think it's really important to highlight we're all at risk of measles. In fact, adults who get measles for the first time have a significant risk of complications as a result of that. So it's something that we all need to be aware of.
And I suppose the thing that we think about with measles is we're told that it's one of the most infectious diseases.
It is. So as far as the rate of transmission between individuals that are susceptible, measles is the highest up there. So, the classic description is if you go into a room with immunised or people who don't have immunity against measles, many people will be infected, of the order of about 15 to 20.
Astounding. And Australia has done an enormous job to protect itself against measles. And in 2014, I believe it was, we reached a status of elimination of endemic measles. WHO announced it. Enormous achievement, big up for Australia. But we're seeing cases again. Why is that?
So there's a couple of things in there. So the WHO elimination status means there's no local transmission, consistent local transmission of the virus. So we achieved that in 2014. But importantly, even prior to that, through the efforts of many, our rates of measles were low. Many other countries have achieved that status, and clearly countries are striving to do that because it shows that measles is under control. And measles was under control in Australia, is under control in Australia because we still have high vaccination rates. Prior to 1966, we didn't vaccinate against measles. So it means the only chance you had to develop immunity against measles was to be exposed with a risk of the complications of that. In 1966, we started vaccinating against measles. 1968, we started vaccinating against measles, and importantly, we had continued through that period of time. What we did discover, particularly in the 90s, is that the single dose that we were using was often not protective enough. So we really ran a campaign to make sure everyone had second doses. And through that effort and high vaccine uptake, we were able to eliminate measles from Australia.
This year, I believe, we've had more cases in the first quarter of 2025 than we saw in 2024. Why are we seeing that?
So you're right, we have had as many cases this year as we had last year, and we're only a quarter of the way through. And importantly, it's the biggest year since 2019, when our pre-pandemic we did have a big measles year as well. And the reasons are the same. One, we do live in a world where there's still circulating measles. So measles introductions into Australia are an ever constant risk. Travellers going overseas, being exposed, becoming unwell and coming back. And then local transmission as well. So it's something that public health officials are very concerned about. And importantly, that's why we really try to identify measles cases very early, make sure that those around them are protected so that we don't set up local transmission.
And Chris, being vaccinated, you mentioned just once again, if you were vaccinated after 1995, 1994, something like that, you got 2 doses. But if you were born somewhere between 1966 and that time, you may have only had 1 dose. What should someone do if that's them?
So if you don't know your measles vaccination status, you should have a measles vaccine. And for many people in that age group, people of my age, they may not know their measles vaccination status. I'm a healthcare worker, so I do, but actually most people doing other jobs, working in the community, don't know their measles vaccination status. And it's highly possible that they've only had 1 dose. And so they should turn up and to a healthcare provider and get a measles vaccine. And the vast majority of states, I think all but 1 state, are offering that free to adults because we want to try and maintain high measles immunity in the community. Because there are some groups that we can't vaccinate. And they're the group that we're really trying to protect. So all of us in the community, if we maintain high vaccine coverage, high levels of measles immunity, we decrease the risk of that local transmission occurring. The more vaccinated people out there, the more people with immunity against measles, the harder it is for the virus to move through the population.
Where are we now? Who recommends a 95% rate of vaccination, immunisation? Where are we now?
So it depends on which population we look to. We know that we're not near that, particularly for the younger adult population, the middle-aged adult population that may have only got 1 dose. In fact, we're well off that at the moment. As far as young children, we are approaching those rates. Our rates of completion of vaccination at 24 months, in other words, after you've had 2 doses of measles, is close to 90%. Now, clearly, I'd like that higher, but that's not the only issue at play here at the moment. So one, making sure our children are well vaccinated, making sure the gaps in immunity in our older populations are covered. Both of those are critical.
Yeah. So let's just be really clear here. Who should be vaccinated and who shouldn't be vaccinated?
there's very few people who shouldn't be vaccinated. So the current vaccine recommendations for the children are doses of measles-containing vaccine at 12 and 18 months. That's your 2 doses. And everyone is recommended to get a measles-containing vaccine unless you are immunocompromised, because the measles-containing vaccine is a live viral vaccine. So there's a small group of the population whose immune system, for a number of reasons, whether that be treatment or by the nature of their immune system, can't have a measles-containing vaccine. And unfortunately, they're the group that are at increased risk, and we as a community need to protect. But to get back to your point, the vast majority of us can have a measles-containing vaccines and are recommended to have a measles-containing vaccine. One group that I am very keen to highlight to your listeners is the group under the age of 12 months. So traditionally, 12 months and 18 months is when we offered a measles-containing vaccine. In the first couple of months of life, a baby is normally protected by the antibodies that flow from the mother to the child. But then there's a window between when those antibodies wear off and when we usually give our first measles-containing vaccine. So those children, particularly in the second half of their first year of life, are at increased risk of measles if they're exposed. And many parents are travelling at the moment. So importantly, if you are travelling with an infant, you can actually have a measles-containing vaccine as early as 6 months in Australia, which will protect your child over that period of time. And while we're talking about babies, there's one thing I forgot to mention. So measles-containing vaccine is not recommended during pregnancy as well. So particularly if you're thinking about pregnancy, thinking about travelling, all of those things, making sure you're up to date pre-pregnancy is another critical bit.
Where to from here for measles? You're a career researcher. Where are we up to in research with measles?
So, measles, our first challenge is making sure that we respond quickly to incursions of measles into the community, and public health are very good at doing this. They put a lot of effort into this so we don't get outbreaks of measles. So that's the number one task of public health. As far as where we are globally at the moment, particularly given this disruption of the COVID pandemic on public health infrastructure around the world, we have had significant drops in measles-containing vaccine rates, and so we will unfortunately continue to see measles outbreaks around the world, particularly in our region. In fact, if you look at where most of the measles cases in Australia come from, it's either those who've been exposed locally or it's some of our closest neighbours. And I'm thinking about countries such as Indonesia, Vietnam and Philippines. That's not to say that those countries are particular standouts. It's just an indication of where people go to travel and, importantly, where people visit friends and relatives and come back to Australia. So our biggest challenge from a research perspective is how we make sure that we are reinvigorating measles vaccination programs in some of our closest neighbours. We support our regional partners to do so and to go from there.
What's preventing Australians from being immunised at the moment?
There's lots happening at the moment in the immunisation space. There's 2 big issues in my mind as far as vaccination in Australia. It's access and hesitancy. Access is something that is not trivial. People are still finding it hard to access immunisation services. It's hard to get into your GP, those sort of things. So we do need to continue to break down the access barriers to immunisation, whether that be me being able to take my child to my local child health clinic, my ability to be able to get into my GP. So there are lots of different ways that we can do that. One, we need to make sure that immunisation services are distributed, are in places of need, are culturally appropriate, are open at times when parents and working people can get to them. There's all those things that we absolutely need to go. But also, we do know that there's increasing concern about use of vaccination in the community, hesitancy would be a word that a lot of people use. So we do need to do things like we're doing right now. We need to sit down, we need to talk to community people about actually why we are doing this at this stage, the dangers of vaccine-preventable diseases, the safety of vaccines that we're using, what processes occur as far as registration and regulation of vaccines, what we do to monitor vaccine safety, how we know that vaccines are working, when do we think that vaccine programs need to change, all that, so people understand actually this is an incredibly robust system that has protected Australians for many decades, and we need to continue to invest and communicate about.
We're very lucky in Australia to have the Therapeutic Goods Administration, a very, very high standard of vaccine safety in Australia, and measles is one of the safest vaccines.
So, measles-containing vaccine has been used for decades. We have achieved a huge amount locally, globally, with measles-containing vaccines. In fact, if you look at the data that has been published since the release of the EIP, so the global program as far as vaccinating children, which has been going for 50 years, the number of deaths saved from measles vaccines is the largest compared to the other vaccines. So measles vaccine is a incredibly
hard-working vaccine,
powerful tool for basically saving children's lives globally at this stage, and importantly will continue to be. So we need to invest in it and promote its use.
Well, considering the vaccine is such a success story, I think it's really important that Australians hear that this hardworking vaccine is responsible for saving lives and has done for a very long time. There's also been some myths around the measles vaccine. Tell me about that.
So measles vaccine was purportedly linked to increasing rates of autism in the 90s. And so this myth has continued to circulate despite incredible evidence, incredible hard work by many to debunk that myth. So there is absolutely no evidence that measles-containing vaccines are linked with autism or other behavioural issues in children. We have incredible evidence, such as looking at large data sets from countries that have incredible records, such as Denmark and other Scandinavian countries, that have looked at the rates of autism in those who have measles-containing vaccines and those who don't have measles-containing vaccines. And most importantly, there is absolutely no difference in the rates of those conditions in those who've been vaccinated versus those who haven't. So I think it's important that we continue to highlight this evidence because these myths continue to circulate and parents only want the best for their child. So when people start raising these things, parents get scared. I understand that. I have children of my own. But importantly, there is no evidence that measles-containing vaccines are linked to many of these concerns. In fact, measles-containing vaccines are incredibly safe and protect children against measles, which is what they're designed to do.
And importantly, measles vaccine is for adults and for children and protects the vulnerable in our community. Chris, thank you very much for joining us today. As ever, you're an incredible authority, and it's wonderful to hear you talk about such an important subject. It's such an interesting time for public health with measles back in Australia, and it's a very important message we need to send today. So thank you.
My pleasure. Thank you.
Thanks for joining us on Matter of Facts. You can get all of the Matter of Facts podcasts on ifa.org.au. Thanks for joining us.